Hello, everyone. This is Brianna Miko.
Hope all is well. I'm Ava Adams.
And I'm Tessa Stevens, and thanks for joining us.
We're here for connecting and supporting people,
Sharing relatable moments,
Always encouraging and always growing. We're
practically.
social work.
Hey y'all, welcome to an exciting episode of Practically Social Work. Today we have on a family member of mine, someone who is near and dear to my heart, my sister cousin.
Oh,
So Dakota, if you could please introduce yourself and tell us a little bit about what you do at work, your different professional roles, as well as all of the different settings that you've worked in.
My name is Dakota. I'm a board certified registered nurse. I've been a registered nurse for about 5 years now, but I've been in the healthcare field, I'd say for about 13 years. I started off as a nursing assistant and then went into clinical informatics and then decided to go to nursing school. And in fact, I will be starting nurse practitioner school in the summer. Most of my
Wow.
nursing experience, right? Most of my nursing experience has taken place in like an inpatient setting, medical, surgical, telemetry type units, as well as some outpatient settings. I've done some jobs as a school nurse as well, but most of my experience is in an inpatient setting. So patients who are acutely sick, not really chronically managed like that.
You were nursing assisted and then you did something else before you became a nurse.
Okay, so clinical informatics. Clinical informatics is pretty much like the Department of Healthcare where, we're in the future. Most of our stuff is electronic. So we have electronic medical records, EMRs. People have created software systems where it allows doctors, nurses, and other healthcare professionals to document their patient care, prescribe medications, administer medications, and it safe lines patient care to prevent errors. There's a lot of studies out there that prove EMRs and other health record systems decrease medication errors. So I think it was President Obama who passed the law that told hospitals that they need to be on an EMR system by a certain year. I think it was 2016. All hospitals in the United States had to be on an EMR system because it has been proven to keep patients safe and, of course, decrease medical errors. So with that job, I went around to different hospitals in the country and I trained doctors and nurses on these computer software systems and pretty much taught them how to do their job out like inside a computer, if that makes sense. So they went from writing their notes on papers, writing prescriptions on papers, to everything that was in the computer now. And it also made the patient's healthcare record available to themselves. So if you think back in the day, you didn't really have access to your healthcare record unless you asked for a photocopy of it. But with the EMR systems, the patients are able to access their own healthcare. And I was just training doctors and nurses on how to use the computer system,
Nice.
which, it allowed me a certain type of experience. It made me realize that healthcare is nothing but a set of protocols. If this happens, then you do that. And it kind of gave me a step up for at least to start my nursing career, because I realized that although every patient is different, the nursing job and healthcare is pretty much the same.
Absolutely. So I want to talk a little bit about Henrietta Lacks, for those of you who don't know who she is a woman. She was born in 20. And what made her so important is that she was diagnosed with cervical cancer several months after giving birth to her son. And she felt like she had a lump inside of her and she had some like bleeding thing, some indicators that there was something wrong. And it went undetected by doctors at the birth of her son and then at a follow-up examination 6 weeks later, which I think is important to note because, doctors miss things. She ended up going to Johns Hopkins Hospital for treatment and they removed some tissue and they did cultures on it. They started some research on that. And there was a doctor who was searching for an immortal cell line in cancer research. And her cells, which they ended up naming HeLa cells, were the first immortal cells that had ever been discovered. So they survived all the testing that was done on them and they multiplied it at an extraordinary rate. So she was unaware, Henrietta was unaware that her sample had been taken and that it was, at the time, it was not uncommon to study patients and their tissues without their knowledge or consent. So while her cells were kind of thriving, multiplying, still being used, she declined and she ended up passing away. However, her cells continued to thrive in culture long after her death. And they contributed to the development of drugs for numerous ailments like polio, Parkinson's disease, leukemia. And in spite of this, until the 1970s, her role was unknown to even her family. And her case is really important because it just kind of, shows even an institute like Johns Hopkins, doing this research where they should have, share with at least her, if not her family. And they didn't for, decades. Her family had no idea that her cells were being used for this. And so it's still being debated and kind of fought in court even to this day. So,
Wow. To this day.
yes.
Wow.
That's wild.
And I mean, it's wonderful when we can learn so much from something like that, but like at the same time, like, that because she was Black, they're not, they were going above and beyond because they could.
Right.
Yeah.
Because they could.
It's messed up.
Yeah. And it's wonderful that her cells were used and have helped so many people. But, what if she didn't want them used? She had that right to make that decision,
Absolutely.
and that right was taken from her. So.
Mm-hmm. On the other end of shady things that the U.S. has done, shady things the U.S. government has done. So in the 1930s, the Tuskegee syphilis experiments.
Oh,
Oh boy. So there was about 600 Black men that they decided to start tracking for different like health related conditions related with syphilis.
How many did you say?
About 600. So about 2/3 of them had syphilis. Well, 1/3 did not. Between 5 and 10 years into the study, they find a cure for it. And syphilis is one of those ones that it can be terminal if it's not taken care of. So they're tracking these men. There's no treatment being provided. These men are going home to either their wives or lovers who also can contract it. So one, they're putting, their wives and lovers at risk, but that just makes it a community risk. And they never say anything about this treatment, never offer it or anything. And this goes on for 40 years. 40 years. How damage?
I didn't know about that one.
I
Like,
didn't know it was
ethically.
that many men.
Yeah,
I didn't think it was 40 years.
it's a lot. Like, think
Yeah.
about the number of people that affected. One, they should have been offered treatment. That's just messed up. Of something. They're predatory and they went after low-income Black men. It's not right.
It's not right. That's an understatement.
Absolutely.
Mm. Well, some of us know that Black bodies are different from white bodies in a sense of health biology. For instance, high blood pressure is a frequent thing among Black men and women. Black women are more likely to get fibroids during pregnancy. There are different clear differences between Black bodies and white bodies, and they're known in the medical profession. Would you agree with that, Dakota?
I would agree with that.
In that case, it's like it's confusing for me because I've done a lot of research on my own with this, especially with Black women and pregnancy related deaths. For example, because of these issues, we should be treating Black women in their gestation a little bit differently, a little bit more delicately because of these issues, right? But in reality, Black women in the United States are way more likely than white women to die from pregnancy, which is a sad truth. It's 243% more likely, which is, it's like, oh my gosh. And this is true regardless of your education, your age, your gender, whatever. And like in most cases, a person like Dakota, who is well educated, even has experience in the healthcare field, might have more issues, for health outcomes, might have poor health outcomes, especially during childbirth.
And it's real. I have a friend whose wife passed away a couple of days after childbirth. She was discharged from the hospital, went home, was complaining of stomach pain, went back to the doctor, my stomach hurts, went to the hospital, my stomach hurts, kept saying it, my stomach hurts, and nobody was listening to her. And come to find out, she was bleeding internally after her C-section surgery. So during her C-section, something must have happened that caused her to bleed. And they sewed her back up, discharged her, went back home, and ignored her stomach pain, and she passed away a couple of days after giving birth to her daughter.
Mm.
This was just 3 years ago. So it's just an example of how certain people of races or ethnicities aren't listened to when they are getting health care.
Mm-hmm.
The most important thing is to advocate for yourself.
Yeah.
When you're sick or you're receiving health care, you have to stand up for yourself, do your own research, because at the end of the day, doctors and nurses are humans. They're just like you. They make mistakes. They're tired too. They have a personal life that's going on. I know they say the doctors might have a God complex or whatever, but they're not all knowing. You have to be able to advocate for yourself, because people make mistakes all the time.
Mm-hmm.
But if you're experiencing discriminatory patient treatment, like complaining of pain and being ignored, how do you advocate for yourself other than saying, hey, listen, I'm in pain? Like, what else? Like, what else can you do?
So, as a Black woman, you never want to be that Black woman. So I feel like that's a struggle in itself. And you don't want to inconvenience someone. I feel like maybe when you're in that situation, you feel like that. And then on top of that, nobody's listening to you. But someone of another race, like say a white woman, they're going to start, in other words, they're going to start threatening people. I want to see your manager. I want to see the supervisor. Let me see, and those are like key words, and people drop everything because you get scared. You're like trained to fear upper management in healthcare, and it affects the care that you provide. So that's why I say you have to advocate for yourself. You have to ask questions. I want to know what's going on. What medication is this? What's going on next? Oh, you're not doing this? Well, then I want to speak to the manager. I want to speak to the supervisor. You know,
Right.
and that's
I want someone else. Yeah.
I was gonna say, I think what also plays a part and quite opposite of what white women might do, a Black woman is often vilified for advocating for herself, for
Right.
raising her voice to get attention. And so I think a lot of us tend to keep our mouths shut because we don't want to be that angry Black woman, that
exactly
loud, sassy Black woman, because
right.
that's the narrative.
Right. And then in turn be mistreated. But you're already getting mistreated at baseline.
Yeah. But now it's your fault. Like whatever
Right.
happens
It's
now.
Right. It's like a self-fulfilling prophecy. So you're like this is stuck between a rock and a hard place. But I say speak up for yourself. Fuck it.
And what if we call these people out? But what if people who aren't being taken seriously say, why is my pain not being taken seriously? Why is my whatever not being taken seriously? Call them out on their bullshit. Sometimes that makes people so uncomfortable, almost in the same way you're gonna ask for someone else. Maybe.
You know, when people are in the hospital, they're in their most vulnerable state. And
Absolutely.
some people, to even ask for a cup of water, it's hard for them. So to bring attention to their pain or something that they feel might inconvenience the healthcare worker taking care of them, I feel like they would rather keep it to themselves.
Yeah, that's a good point. Absolutely.
One thing that if you have anybody close to you in the medical field, bring them with you. Have them advocate for you. If you have somebody who can help you that's in the medical field, bring them. Because more likely to know the clinical talk that doctors like to hear, and they'll dismiss yours if they don't sound clinical or what you're talking about.
Yeah.
Yep,
Absolutely. I was just thinking like you're gonna bring your like your uncle or whatever to buy a car or to get your car
Exactly.
because they're gonna know more. Yeah,
Mhm.
it's like the same thing. Yeah.
Bring your nurse friend.
Exactly. When in the nursing field too, it's sad to say, but when you get a patient that has a family member in the healthcare field, it just seems that like in the report that you get from the previous nurse, they like make it known as if that were to change the patient care you give to
Wow.
your patients. It's crazy. Like
That's some
like
insider
they like
information.
it is. It's crazy. Like I always treat my patients as if they were my family members. I'm a third generation nurse. I feel like I was made for this. It's my personality. It runs in my blood. It's just me. But there are people out there that change their patient care based on who their patient is. And that's just one of the sides of how people do that.
On the
even
flip side of all that, though, because people shouldn't have to bring somebody that's in the medical field with them. So if somebody is not listening to you, ask for a social worker.
Hey.
Exactly.
We got you. We got
That
you.
was a great one, Tessa.
Exactly. How things changed after COVID.
Oh yeah.
People are burnt out. Patient care is at an all-time low.
Yeah, we worked those nurses harder than any ever before, Ugh, and what did they get? A keychain?
A cookie shaped like a piece of toilet paper.
Party.
A pizza party, right? A pizza party that you probably couldn't go to because you weren't working that day or something. Like,
Right. Or it was leftovers because I work night shift.
I was gonna say, and if you work evenings or nights, forget it. You're gonna get the cold leftovers.
Yep. Actually, my ex-manager thought it was nice to make cookies that look like us, and I was only one of 2 Black nurses on the unit, so I got a Black girl cookie, a Black nurse cookie.
Did you take a picture?
I do. I actually have a picture of it.
Make sure you
and
send
meat
it to us
expert.
so we can post it.
We'll make that the thumbnail of the video this
Right.
week.
The Black cookie, the Black nurse cookie. That'd be
Black nurse
amazing.
cookie.
Okay, so I'm gonna ask you guys, have you ever heard of these myths? Black people feel less pain than white people.
I
And
have heard
sorry,
I have heard that one.
you have. Okay. Have you heard?
I've heard it more in a sense where Black people have a higher tolerance to pain.
Okay. Yeah, I think that's more of what I've heard before as well. And then this next myth, that Black people have weaker lungs.
Never heard
That
of
one's
Never.
No. Have you ever heard that Black people can't see at night? They can't see well at night.
Never heard of that either. That's
That's
a new
another,
one.
No.
that's another
who can see well at night.
myth. Right. Who can
Just
Who
get
can
up.
see well when the lights are off? Exactly. Well, anyway, so we've got some sources that we want to share with you about healthcare biases, death rates, all of that in a fact sheet that we're going to link below.
Yes. So something else I wanted to bring up is how studying the mistreatment of Black people's health and how that can help other people too.
Mm.
Yeah, with more education on exactly how biologically and only biologically different Black people are from white people, it might develop the medical field in ways that they can provide, professional and proper services and treatment. That definitely needs to happen. I don't know why it hasn't.
I was going to say, I wonder why it doesn't. And this is not a great analogy, but this is just what popped to mind. It's a fact that women with red hair, right? They need different anesthesia than other people. Just biologically, they're different. So why are we, studying that kind of difference, but we're not making it a point to study other differences?
There's one example that I do know of for sure in the medical field, how we treat people who are African American versus non-African American. And that is the algorithm for citing like kidney function. There's like 2 different algorithms that you use, whether you're African American or not African American, or Black and not or non-Black.
Interesting.
That is
Okay.
interesting.
Yeah.
Okay. So they have different kidney function.
Yeah, I don't know it off the top of my head, but it is. It's far like your glomerular function rate is different.
Can I throw a question out there, even though it's not on the sheet?
Ooh.
So it's not really like a question. It's more of like I'm kind of curious. I don't know how to make this sound without it sounding like weird or like inappropriate, but like,
I'm scared.
don't be scared. Like, I wonder how many differences there actually are, or is it the lack of preventative care that Black people have access to compared to white people?
That's a great
for
point, Tessa. And not to interrupt you, Dakota, but I can answer this. I think that coupled with the biological differences, barriers to healthcare and access to services and treatment play a huge part. But it's not the only fact. It's just a contributing factor. But yeah, that's an incredible point that you bring up. Thank you.
Do you think there's like a barrier of sort of like African American people are not seeking out healthcare, just like like it's passed down from their parents, like
Culturally,
culturally.
absolutely.
Yeah.
Yeah, I mean,
Mm.
not only I think that's honestly an American culture. We all ignore our
Yeah.
hair, don't we? Like, I think that it's common for people to be like, I haven't been to the dentist in 2 years. Like, literally.
But
Yeah, they're
I was,
scared, and
yeah,
it costs money.
absolutely. Yeah, yeah. All good points. So another question I had for you, Dakota, can you share a time when you witnessed racial bias in the healthcare field?
I can recall one time when I was receiving a report from a nurse, and one of the patients were, I believe, African American, is African American middle-aged woman, and she had kidney stones. And kidney stones are very painful, no matter who you are, man, woman, black, white, pink, brown, because it's stopping you from urinating. You have a big calcified material in the tubes of your kidney. It's painful for anybody.
Mhm.
But of course, there are a lot of patients who sometimes, like the pain management that we prescribe or the doctors that prescribe, it's just ineffective for them, and they need different types of pain medication. And when I was getting a report from this nurse, she was pretty much insinuating that this patient was making up the pain because she gave all of the pain medication that was prescribed as it was prescribed. It was like the nurse couldn't understand why this patient was still in pain, even though she gave them pain medicine. And pretty much just insinuated that this patient was making it up, and that was because of her racial bias. Yeah, she was either assuming that this patient was drug seeking, or there's no way that this patient could be in pain. I gave them all the pain medication I could.
I think
And
that shows a huge lack of empathy on her part as well.
yeah, totally.
Yeah,
Because
is that what it
who's to
is?
say?
Like, I mean,
Well, I'm not saying that's the only thing. I'm
I
just
would
saying
say it's a lack of empathy, sympathy, knowledge,
understanding.
yeah, like everything, bro. Like
Right.
what?
I always hate when anyone who's not that person, and they're like, oh, I gave them this medication. I gave them enough medication where it would knock me out.
Mhm.
But you have no idea what that person's
Right.
body is like.
Yeah,
You have no idea.
everybody is different.
100%.
Exactly.
Just because it
And
works
pain
for
is
one person.
subjective.
Exactly.
Pain
Some
is
people deal
subjective.
with it better than others. They just do. That doesn't mean they should have to either. That's very upsetting. I agree.
And that's that's when you advocate for your patient. But then that's when I took on this patient, and you ask the patient, what's your pain? You find out that nothing's working. You call the doctor and ask for something else. It's,
Right.
you advocate for your patient. What you have on board, doctor, is not working for the patient. Can we try this? Can we
Mhm.
get something for them?
Right. And in the
But
meantime, maybe even like a heating pad or something could have helped her until the doctor came through. Anything to help.
yeah, like, it's unfortunate.
And so, kind of leading into that, what do you think we can do to hold clinicians accountable for their biases? Did you say anything to that other nurse or?
That's the thing. It's like the jungle at work. You can call people out, but I feel like, at least for me, I pick and choose my battles. I knew that I could take this patient on and fix it. It wasn't a situation, to me at least, where it was that severe and dangerous where the patient's life was at risk. I would definitely call somebody out if they totally ignored somebody and put the patient's life at risk.
Mhm.
But
Yes.
even though this situation was wrong, I felt like I was able to take it on, handle it, and fix it. But yes, you should definitely call people out. But at least for me, I have to pick and choose my battles,
Yeah.
because I need to be able to depend on that nurse too sometimes.
Right.
during my
And you have to work with her as well. So you don't want
right.
to, sort of rock the boat for, like you said, you knew you were going to help that patient. You were going to make her night better. And
Yeah,
It's
definitely
really
have
hard.
to hold people accountable. I think that's especially after COVID and the shortcuts that were created to save money, to take on a larger patient load, like the
Mhm.
things that the healthcare companies did and hospital companies did to their healthcare workers. I feel like it damaged people, and people are burnt out, and nobody is being held accountable for their actions anymore.
Right.
And I feel like healthcare has definitely gotten worse after COVID.
Mm.
A lot of people need to be held accountable for their actions.
So what would you tell the people listening that they could do?
Keep yourself educated, advocate for others and yourself. I'm from New York. If you see something, say something. um, you know, that's all I can say is keep yourself abreast to what's going on. Again, that makes me seem like you're always at war, but that's what it is. Healthcare is it's your life is at risk, so
Yeah.
you gotta
Mhm.
Yep.
Yeah.
be on your ones and twos.
Mm.
Is there any specific advice you would give to a Black person experiencing barriers to their healthcare?
Find out resources that could help you. Maybe go to your local community center, local church. There are community resources out there to bridge those gaps in the lack of access to healthcare.
Mm. Yeah.
Call a social worker.
What?
I said, and call a social worker if you need to.
Yes.
Oh
the
yeah,
social
call a
worker.
social worker. And honestly, and that's the thing. Like, I see social work notes all the time at work, but I feel like maybe their patient load is high too. I don't know if you guys are familiar with the acute care setting of the social worker, but I feel like they just pop in, pop out, make sure it's a safe discharge, and that's it.
Mm.
Maybe social workers are burnt out too because their patient load is absolutely outrageous.
We're all burnt out.
Yeah,
I'm not even a
healthcare is
social worker yet. I'm burnt out.
it's interdisciplinary. We have to always remember we have a lot of other professions we can lean on.
Yes,
Absolutely.
absolutely. Well, my dogs are fighting, and I'm afraid that you might start hearing it. So we're going to wrap this up now. I'd like to thank Dakota again for joining us today and giving such wonderful advice to us as well as our listeners. I would like to thank you all for tuning in and passing on the word, raising awareness about medical racism and healthcare biases. It's out there, it's happening now. It's not a problem of yesterday, it's a problem of today.
Hmm. Absolutely.
Sure.
Awesome.
Thank you so much, Dakota. That was a great conversation tonight.
Thank you. I appreciate it. I have a passion for it,
Before we depart for the day, we want to remind you that if you have topics you would like to hear about or just have general comments, feel free to reach out and submit those.
Or if you have a topic you want to discuss with us here, reach out. We are always welcoming of making new connections.
Our site is linked below, but please check out our TikTok, our Instagram, and subscribe to our YouTube. Talk to you later, everyone, and thanks for listening.
And remember, take care of your future.
Take care of each other.
Take care of yourself.